New data is highlighting the alarming rise in drug overdose deaths in the U.S. Based on the latest numbers, the CDC predicts more than 90,000 overdose deaths happened between October 2019 and September 2020. That is the most ever recorded since the opioid epidemic began in the 1990s. And the amount of overdose deaths has climbed since the COVID-19 pandemic started. So for more on this, I want to bring in Dr. Michael Barnett. He's an assistant professor of health policy and management at the Harvard T.H. School of Public Health. Thank you so much for joining us. So let's first look at these numbers. I know we talked about overdoses. I don't know if those numbers are specific to opioid overdoses, but I know that opioids and COVID-19 have sort of crisscrossed in a number of different ways. Certainly people haven't been able to get their addiction treatment, in-person treatment because of the epidemic, but there are also sort of health impacts that come with opioid use and that sort of intermingle with COVID that can have some dire consequences. So can you tell us what's driving these numbers?
Thank you for having me. This is, of course, an incredibly important public health crisis that has come along with COVID. Some people are calling them twin pandemics that have collided with one another. I want to point out that before 2020, we went into the COVID pandemic with an out-of-control public health crisis of addiction. 2019 actually had been the worst year on record for opioid overdoses up until that point. And there are indications that 2020, even without a pandemic, would have been terrible as well. However, during the pandemic, as all of us have experienced, add the stress of the pandemic, extreme isolation, job loss, and you really have a perfect storm for addiction to flourish. And add that on top of the fact that mental health problems, largely due to these factors, exploded during the pandemic. And you have huge increases in the number of Americans reporting symptoms of anxiety and depression. And all of these are issues that can either lead people to addiction or worsen addiction in those who might be predisposed.
A new study of COVID-19 long haulers treated at VA facilities found that doctors are prescribing more opioids for them. One of these study's authors tweeted, "We must act now to prevent this from ballooning into another opioid epidemic." Doctor, you know this. Long COVID symptoms can be debilitating, but is there an alternative to opioids that can help some of these individuals?
It's a great question. I did review that study in Nature, and they looked at thousands of veterans in the Veterans Affairs health system and found that about 10% of them had persistent symptoms after their infections for 6 months. And they found a much higher rate of prescribing opioids and other substances like sedatives in that population. It does turn out that we have a lot of different options for treating pain. And there are a lot of misconceptions about when we should or should not use opioid medications. It actually turns out now that we really do have evidence in this kind of post-crisis era of opioid prescribing that in many ways opioids aren't actually special as pain medications go. You can actually get the same amount of pain control in many, many circumstances using over-the-counter medications like ibuprofen or Tylenol than you get with opioids. That may be hard to believe for many people, but the evidence has really been, has confirmed over and over again that opioids are an alternative to those medications, but they aren't some kind of extra special boost that is way more powerful than those others, that actually many people can achieve pain control without the use of opioids, and that we should be trying those first.
You've actually researched how doctors prescribe opioids. What have you found, and what needs to change?
So opioid prescribing really exploded from about the 2000s through a peak in around 2011 or so. Opioid prescribing actually increased by 400% across the country. And this is the trend that's behind a lot of the lawsuits that have been swirling around, where just millions and millions of opioid pills would pour into small towns or small counties, for example. What we know about how opioids were prescribed, especially 10, 20 years ago, is that it really was an evidence-free zone where doctors want to treat pain, they want to help people, and there was a very strong concerted marketing push by manufacturers of opioid medications that kind of infiltrated the medical community and created the impression that opioids were really kind of a neglected medication that really we should be using for pain control much more frequently than they were before. And there wasn't really much evidence to back up how, when, or why opioids should be used over other medications. That created a fertile ground for opioids to really be prescribed in all sorts of different ways by different doctors, which creates the opportunity for there to be a lot of inequality in different regions of the country where opioid prescribing could be 10 times higher than another, creating the opportunity for much more addiction and distribution of opioids to throughout the whole population in certain areas of the country.
Dr. Barnett, you've actually been an expert witness in a number of opioid cases. There's a trial that's set to start today in West Virginia. The city of Huntington and Cable County are suing 3 drug companies for more than $1 billion, and they say that they will use that money to fix the damage caused by opioids in their community. The drug companies claim that they are not responsible for doctors prescribing these drugs. What's your take on this case? And in your medical opinion, is one more at fault than the other?
Yeah, this is a $64,000 question, of course, behind the thousands of lawsuits that are swirling around. The lawsuit you mentioned in West Virginia, Cabell County, which is where Huntington, West Virginia is located, they're suing 3 of the largest distributors of pharmaceuticals throughout the country that have been implicated in many of these lawsuits. And, it's hard for, I think, any single person to weigh in on who is is there a single player to blame? I think there are many players in the growth of the opioid crisis across the country, and there's plenty of blame to go around. For the distributors, these are the ones being sued in this particular case. They play a key role because they're the ones that actually give the opioids to pharmacies, and they have an obligation to report suspicious orders. So, for example, in this particular lawsuit, according to the complaint by the plaintiffs, just one of the distributors that are defendants that are named in the case, AmerisourceBergen, distributed enough opioids in this county of 100,000 people for 2 prescriptions a month for every single resident for 6 years. That's over 15 million prescriptions just in this one small county in West Virginia. And I think it's fair to say that even though distributors may not be the only players in this whole crisis, not really turning a blind eye to orders of that magnitude in such a small town where it couldn't possibly be used simply for pain control is something where they had an opportunity to make a big difference, but they clearly didn't, as was the case for many other players in this epidemic.
Dr. Michael,
Doctor, we started off this conversation sort of talking about kind of the way the way the pandemic and opioid use are sort of crisscrossing each other and making the situation worse, possibly making the situation worse. And whether or not, as we look towards the future in dealing with long haulers, we will find ourselves with another sort of spike in opioid use because of long haulers being prescribed opioids. I'm wondering, though, Doctor, at this point, there's been so much media coverage, all these lawsuits. I can't even believe that opioids are really being prescribed. I'm wondering if there has been a shift after all this coverage. What are you noticing when you speak to doctors? Are they more resistant to prescribing opioids, or are they still prescribing them, but with additional information or with an eye towards being aware of whether or not their patients are displaying a dependency? I'm just wondering just how opioids are being treated now, because obviously they do work as they are intended to stop pain, and so they're a good option to a certain degree, but clearly they come with tremendous risk and liability, it seems, at least from my perspective.
That's a great question. It's a very fraught atmosphere now for physicians in terms of how do we treat pain and how do we use opioids. And there is little question that when we were at the peak of opioid prescribing in around, say, 2011 or so, where every man, woman, and child in the U.S. Theoretically we prescribed enough opioids for every man, woman, and child to basically receive 1 month worth of opioids in a year. To a point now where we're now down to the year of 2000 level prescribing, down 50% from the peak. And on the one hand, I think there has been an enormous reckoning with the degree to which we let ourselves be deluded as to the potential indications for when we should be prescribing opioids, at what level, and the potential risks for them. On the other hand, the pendulum has also been swinging in the other direction in that, I speak to residents and medical students who really seem frightened of prescribing these medications right now. And it's, in some ways, it's kind of a polarized atmosphere like we see in so many areas in America, American politics and American culture right now, where it seems like opioids are either, a terrible villain or some kind of misunderstood last hope for pain control. And like many complex issues, the reality is somewhere in the middle. We should be using them. We have to use them. They've been an important medication for thousands of years. However, they do carry really noticeable risks that we should avoid if we can. And I think the reckoning of everything that you've been talking about, as a medical community, we need to really generate evidence and have education that can put these medications in the right context and educate patients that they are useful, but they are not the be-all, end-all. But they're also not medications that we need to be so frightened of that they can't be prescribed anymore. I know that's not a simple answer, but unfortunately, it's a nuanced issue, and they still have their uses. But also, in some ways, in many contexts, people are also much too frightened of them when opioids still have their use, but they just have to be, but it's just very different than the way we were thinking about them 10, 20 years ago.
Really important information there. Dr. Michael Barnett, thank you very much. Appreciate it. Really interesting discussion.
Thank you for having me.